Welcome to this week's edition of Feel Good Friday. Feel Good today, we are focusing on lumbar. It's Valentine's Day. Happy Valentine's Day. And I hope at the very least this will be a good Valentine's treat to get you started with your weekend right. A lot of us deal with chronic back issues, and today we're going to go over a couple of ideas to loosen the spinal area here. And I'm realizing I don't have my step here. Hang on one second as I make a whole bunch of noise behind camera. I said earlier today we would be using a step or an assist, and we're going to do some on the ground exercises here shortly. So today we are covering 4 basic positions. Instead of spending 20 minutes trying to get everything straight on the chalkboard like I did last week, I've posted in the feed, and I'll repost in the video the settings depending on which type of machine that you're working on today. We're going to start with a warm-up of a pelvic tilt. As I always do, I'm going to keep it to 30 seconds today. If you're on a pivotal style platform, I want your feet hip width apart. If you're on a vertical style platform, I want you on a low amplitude setting if you have that option. Pivotal, we're going to start with a frequency range of 12 to 16 hertz. We just want to loosen up things. If you're on a vertical style platform, keep that lower at the 30 to 35 hertz range. And we're just going to keep the knees slightly bent and do some tilts. Slowly time it with your breathing. Tilt those hips forward, backwards. Maybe shift to the left or the right. Just get some movement and loosen up that core area. Okay? And you would do that for 30 seconds to a minute depending on what your time allows. The next one we're going to go into, if you have poor mobility, if you're short on time, there's a way you can target the low back just in a standing position. Because we're targeting the back and the spine, I want you to reduce your amplitude. So if you're on a pivotal platform, I want you to start with your feet about an inch apart. If you're on a vertical platform, keep your amplitude setting on low or low intensity. I want you to lean over. If you have a machine with handles, your legs are straight, but the knees are undone. And I want you just having a nice straight spine. If you're taller, you might need to come up a little bit. If you're working on a machine that does not have a handle support, you just let your arms dangle, or you could cross your arms at your chest. You know, and depending on what angle you are standing at, you're going to feel it target the area that you're trying to hit. If the intensity is okay and you want a little more action, on your pivotal, you could widen up your feet. On a vertical, you could increase the intensity. If you're dealing with, collapsed disc, recent surgery, I suggest keeping the amplitudes low. If your range of motion and balance is good, you could extend this into, touching the toes. Feel a nice stretch up the hamstring and the calves. And then just slowly roll your way back up. Okay, the next one's going to require us to get down on the ground. This is just an aerobic step from my old studio days. We're going to tee that up. Some of you work with a Hypervibe's got a block mat, an aerobic step, couple Pilates, maybe some steps, a little floor cushion, something to get part of your body higher up off of the ground. This can be used to modify a push-up. We're gonna get into what I call a cat-cow position, but we're gonna turn this one around, and we're gonna put our knees on the platform. You may require a mat to do so. So I'm just putting a mat on the machine, and we're gonna back up. On a pivotal style platform, I want start with your knees hip width apart. You shouldn't be wider than your hips. If your back is sensitive, super tight, you may want to bring the knees closer together. On your vertical style platforms, please just start with a lower amplitude setting. We're going to bring this to 12 to 14 hertz. We're not looking for a high muscle contraction here. We're just looking for movement. And you'll hear it in my voice to a degree. As I get closer to the machine with my bum, the vibration will travel more up to that mid-back region. As I lean forward, straighter position, you'll feel it more in the hips and that low back region. And I encourage you to continue, if you do yoga, if you're familiar with the positioning, that movement of the pelvis that we were doing in a standing position you know, try incorporating that. Arch up like a cat. You're tucking the pelvis forward. Go the other way. You want to feel I don't know if you can see it in my hoodie, but you want to see a really good arch in that back. Okay? You can even turn this into a stretch. Okay? You could do this or a variation of this position for anywhere from 1 to 2 minutes, really as needed as a standalone if you like. The next position we're going to get into is massage. On that low back position earlier, I continued on the lower frequency. I'm just realizing the downside of doing things live. In my program outline, I do have that at a higher frequency range on both the vertical and pivotal stat platforms. That's just another option as well. What we're going to do now, we are going to do a low back massage, and I do encourage you to bring up your frequency. On a pivotal platform, we're going to get into the higher exercise, higher recruiting, more neurological speeds. And I want you, 18 or above. I prefer the 20 to 22 range. If you're working on a vertical platform, your massage frequencies are going to be the higher end of your platform. So they're going to be, 40, 45, 50, depending on the settings. Anything above that might be a little bit too aggressive if you're just starting out. On your vertical platform, start with a lower intensity or amplitude setting. On the pivotal style, your spine's kind of going right down the middle of the platform in this position, so there's really no adjustment required. I don't use a mat for most of my massage. I'm going to preset the machine at 20 hertz, and depending on your range of motion, you want to get as much of that low back real estate onto the machine as you can. I'm putting the step behind me to hold up my upper body level with the platform. Okay, and if your feet are flat on the ground, you're going to feel it a little bit more in the glutes. It's great for constipation. To get the lumbar or that arch in the small of the back, lift those legs up. If you do not have a platform with handles, you can just pull your knees towards your chest. If you want to get a little bit deeper, extend your legs straight up into the air. Okay, and try positioning your body in different angles. Swing your knees over to the right, and you'll feel it more on that outer hip edge. Swing over to the other way. You know where it hurts. I'm just getting you into that region. Sort of wiggle your body around and play with your positioning to target your particular area of deficiency. This one I'm going to recommend also anywhere from 1 to 2 minutes. It really depends on your tolerance. If you've never done massage with any intensity on these machines directly on the skin, you're going to find it a little bit itchy or tingly. Possibly during and definitely after you get off the machine. That dissipates after about a week or two. You don't even notice it. So I'm going to sit myself back up. That was about 1.5 minutes on that round. And again, I'm trying to keep these sessions short. More frequent short sessions a lot of times are easier to accomplish and fit into your schedule versus some big long workout, which is kind of a negative word. Workout sounds a lot like diet. So any of these short routines that I'm showing you on Fridays could be used as a warm-up, a wind-down, or just in complement maybe as an off session to some of the stuff that you may be working on as a larger program. Or you could use a few of them throughout the course of the day just to have more frequent use for chronic things like lymphatic, the pain in the back, circulation, whatever ails you, it's all good. The more you move, the more lymph, the more blood, the better the bone density, all the benefits that we're always talking about. Any comments or questions, please post in the feed today. I'll get to those over the next day or so, and I appreciate you so much for joining us again today.